At a time when the world is dealing with yet another new COVID-19 variant, a national study dubbed ACTIV-2 clinical trial is happening across hundreds of locations nationwide. This trial testing a new infusion and an inhalant to treat COVID. One of those trials is happening right here on the Sun Coast. The hope is that this ACTIV-2 clinical trial will lead to treatments for those suffering from COVID-19 in the same way that previous clinical trials have led to vaccines. So to learn more about how this all works, let's bring in Dr. Eric Fulkins, the principal investigator in the ACTIV-2 clinical trial at Bradenton Research Center. You've been treating patients in Bradenton area since 2005. Dr. Fulkins, thank you so much for taking some time out today.
Oh, thank you for having me, Rebecca.
Can you tell us exactly how this specific ACTIV-2 clinical trial is working? What's the goal here?
Well, the goal is to, first of all, make sure that these medicines are safe. This is like any trial, we have to make sure that these medicines are not only safe for patients, but also, secondly, to make sure that they work, to make sure that our goal is mainly to keep these patients out of the hospital. These are patients that are not sick enough to be in the hospital, but they definitely could use some help with the treatment for the COVID.
Okay, so these are people that are still sick with it, but not necessarily to the point where they have to be hospitalized. So right now, you guys are underway with testing. Can people still be a part of this trial if they have come down with COVID?
Yes, ma'am, they sure can. Simply, as long as they're over 18, as long as they've had a positive test for COVID in the last 10 days, symptoms still have to be going on. They still have to have symptoms within the last 24 hours. The symptoms can't have been longer than 7 days though. So obviously we're looking for patients that have just come down with COVID, not sick enough to go to the hospital, but are still having symptoms. Our goal is to try to keep these patients out of the hospital. They have to be high risk. Patients with diabetes, high blood pressure, smokers, patients that are overweight, somebody that may be at a little higher risk to end up in the hospital. Our goal is to try to keep those patients out of the hospital.
So there are two therapies here, an inhalant and another one. Tell us how these work and what the hope is with these two different therapies, how it's different from what we know as, remdesivir and other therapies that have been used.
Sure. You mentioned remdesivir. Remdesivir is an antiviral. It's been around for a long time. I think they tried to get it to treat Hep C, Ebola, and that to begin with, but it has been used to treat COVID in a lot of different countries. The way that it acts is that it gets into the cell and it decreases the amount of viral product that those cells give off. Whereas our active trial, the medicines that we have right now, you mentioned an IV and a nebulizer. Nebulizer, for people that might not know, is like how you would give an albuterol treatment. And it gives out the mist and you inhale it into your lungs. Anyway, these are antiviral. These are monoclonal antibodies similar to the Regeneron that you can get from the state, where it actually these either man-made antibodies or bovine-made antibodies attached to that spike on the COVID-2 SARS COVID-19 virus, and they try to prevent that virus from getting into the cells, from replicating at all.
So how soon, before we wrap up today with you, could this become available to the general public once these trials wrap up?
It's really difficult to say. This trial, especially like this, is ever changing. They'll work with the med for a while, then they'll present the evidence to the FDA, and they'll go back and they'll make a few changes, hopefully sooner rather than later. And it would just be more than anything, just another tool in the box to help treat these patients with early COVID disease to try to keep them out of the hospital.
All right, Dr. Eric Fulkins, thank you so much for joining us today. We appreciate you getting us to speed on this potential new option for those fighting this virus. Thank you so much.
Thank you, Rebecca.